Hello everybody, welcome to this event of this workshop about the Specialist Community Public Health Nurse and the standards. Okay, I'm just going to give you an overview, and then we've got colleagues from our QA team who are going to speak to you as well, and then I will come back shortly. Okay, just before we start, I know there's a lot of people coming in, but I'll just do a little bit of the housekeeping before we start. Just to firstly to let everybody know that this meeting is being recorded, and we will keep the recordings for the whole time that this project is live. The recordings will go onto the NMC website very shortly, hopefully by the end of this week, but they should be there with the update of our support and information. Everybody's cameras will be automatically muted and you will be off, so can we just ask that you keep that off, just because there's so many people we're expecting today. It'd be really quite hard to manage the session. So we can ask that you can introduce yourselves, please, in our chat box, just so we have an idea of who's attending and where you're from. And then also, if you have any questions, please do use the chat box, and we have colleagues attending throughout the session who will monitor that, and we will try and answer some as we go, but if not, at the end of the session we do have an opportunity for some more questions. If you are struggling with the chat box, the email is on the bottom of the page there, and it's educationandstandards@nmc-uk.org, where you can email us, and we will get back to you on that as well. Okay, thank you, Gwenda. Just letting a few more people in, so we'll just be a second then and we'll move on. So as you can see on the screen here, there should be a little black box showing up for you. And I want you to put in the bit where it says enter response, can you just put in less than 3 words any areas that you would like particularly covered today? And it's quite good for us just to make sure we do cover these bits and that we're reaching information that you would like us to. So we will let you start that now. If you just put it in enter response and then press submit, and then it shows up. And what happens is you will see that as people enter the responses, the ones that come up bigger are the ones where people are saying the same thing again, or people are clicking on it and pressing the like button or something, so that we know that we're getting the most prevalent information is coming out there. We'll just literally do this for, not for long, we'll give it maybe another couple of seconds, just so everybody, we've got 25 responses there, but I know we've got a lot more people attending and a lot more people live on the session. But just it gives us a good idea of what type of information you want to make sure that we've got everything in. So I can see a mapping of the standards, it comes up, practice is coming up big, but I think that is, I don't know if that's about practice supervisors or practice requirements, other things. So you may, if I don't cover that, you may want to put it in chat box. Okay, thank you. We'll just end that there and we'll move on to the next slide. That's great, thank you. So we're just going to give you a little bit of the agenda that we're going to cover today, just so you have an idea. Okay, I'm going to briefly give you an overview of the standards, but there is a link, I think someone will put that in the chat box shortly, to the webinar that we published last year around October time by Anne Trotter, which gives you a much more detailed outline of the standards if you want to go back and have a look. And we're going to talk through our colleagues from the quality assurance team through an NMC Gatework framework, and then I will come back to you and we will go through some scenarios, really, some things that you can think about as you go through the implementation process. And we also have a colleague from Wales coming on to give us a really good example of practice. Okay, and then there's a time at the end for some question and answer sessions. Okay, thank you. So just to give you a little bit of background, really, we've talked about this before, but when we publish new standards, and as you'll know, it was 2004 that the last SCPHN standards were published. And when we publish new standards, it's always about putting the heart of the public and the people that we care for and the people that we serve right at the centre of the care we're given. We know through the consultation process what members of the public tell us is that they really value a SCPHN practitioner, and they really value that you do, and they want you to be knowledgeable, to be concurrent, and to be really up to date on new aspects of care and new practice. And they know that you're leading their care, and they really want to have that one named professional who they can contact. Even if you are signposting the care to somebody else, they still want that one professional, that one health visitor, school nurse, occupational health nurse, or even a public health nurse, and that will lead that care. Okay, and they appreciate that you're leading that, and that you're in that work that you do, but also it's really, really important that they want to be involved in their own care decisions, and that's a really strong theme that comes through from all of public consultation. Okay, thank you. Just give you a bit of background, obviously, about the new standards. They are really ambitious and they're really exciting. We do accept and we do acknowledge as well at the NMC that practice hasn't stayed still in the last 18 years since they were last published last year, but actually that you have moved with the changing climate out there in public health practice. We know that the needs of people out there are changing, and actually the care that people are requesting and people are wanting is very different now. So these standards acknowledge that, and they acknowledge the good work that all of us giving practitioners do, how autonomous you are, and how much you understand and why the determinants of health inequalities, and how to meet them across many diverse populations. Okay, thank you. Just to give a really brief outline of the new standards, you'll know that we have one standard, but it has different components to it now, as opposed to the difference between one set of standards complete for everybody in 2004. So our one set of standards will cover health visiting, occupational health nursing, school nursing, and public health nursing. Within them standards, it's up to practice partners and approved academic educational institutions to decide whether they want to put prescribing into the programme. If the prescribing is integrated into the programme, it must be the V300 prescribing route that you do integrate into the programme. And that has been the overarching theme that comes from all the consultations, that actually moving ahead with specialist practitioners and improving practice and changing practice above that of a registrant nurse, and the V300 is much more suited to specialist practice. To just give a bit of outline about how the standards look, like I say, you can get more detail on the NMC webinar that is already on the NMC webpage. Okay, you'll see in a moment the slide will change. It just sometimes technology takes, and that's we appreciate that. Okay, so we have 6 spheres in the new SCPHN standards. The green, as you can see on the page there, they're the core standards that everybody must meet. Okay, so when you're out if you're out in practice now, these standards are live and are what your practice you should be working at in your practice area. And for students on the programme, everybody would meet them green core standards. Then they would also meet the standards applicable to the context of practice of the route that they are studying, or the route that you are practicing it in. Okay, so these standards aren't just to reiterate that point, really, these are out in practice for SCPHN practitioners now. Okay, so what we have is within C to F, you also have different pathway standards. So your health visitor, your school nurse, or your occupational health nurse pathway has additional standards to go along. So obviously as a health visitor, you would meet your core standards plus your health visitor ones, or as a school nurse, you would do your school nurse ones, and again, your occupational health ones. You wouldn't do all of those. So SCPHN practitioner will be relevant to their pathway. Okay, next slide. Just a little bit of information on the next slide is about the SCPHN public health nurse route. Now we know at the moment that's not widely available in the UK, but there has been a lot of interest in it as we've gone out and done a lot of implementation events. Okay, so this pathway that allows a public health professional to gain specialist experience, okay, as a public health practitioner within the sphere of practice that is decided between practice and the university. Okay, it could be across, I don't know what's happened to the slide there. So it could be across a whole range of sectors, for example, things like health promotion, young offender settings. We would expect that this public health nurse adapted the life course approach and a whole population approach to their learning and their practice. They would collaborate with services at a specialist level, just like any skipping practitioner would. And they would get it would apply, their learning must come from theory as well as from the practice area. Okay, thank you. I'm now going to move on and introduce you to our quality team. Okay, Paula, I'll hand over to you.
Thanks, Elaine, for that those introductory slides. That's really helpful. I am going to talk you through some of the QA quality assurance aspects of program approval. And to do that with me is my colleague Ian from Mott MacDonald, who can introduce himself in a second. But I'm Paula McLaren. Most of you know me. I'm the Head of Education and Quality Assurance at the NMC. Ian?
Morning, everybody. I'm Ian Felsted-Watts, and I'm the Quality Assurance Director at Mott MacDonald. I suspect most of you are aware, but just for anybody that isn't, at Mott MacDonald, we are the QA service provider on behalf of the NMC, and we manage the implementation of the QA framework.
Thanks, Ian. So I'm going to kick us off, and Ian's going to come in a little bit later with a little bit more of the detail. So I thought it'd be helpful just to remind people, some of you will be aware, but others of you may not, that the NMC introduced and implemented a new quality assurance framework in September 2019, which outlined our new approach to quality assurance of education and training and really set out our roles and expectations around education and training for nurses, midwives, nursing associates. As part of that framework, we now undertake conjoint approval, which means that as universities approve programs, we also approve programs with the view of kind of reducing the number of events and reducing a bit of the burden on education institutions. We also now give indefinite approval, and as we move into this kind of new phase of monitoring, we've spent the last 6 years updating our standards for all of our programs, and post-registration is the culmination of all of that work. So once you have your program approved, it will be approved indefinitely, and then the focus will be on monitoring. And my team, certainly in the NMC, has done a lot of work around what that monitoring looks like, and some of you will have been involved in annual self-reporting, new program monitoring, etc. But it means that we have an increased use of data and intelligence so that we're better informed. We aim to be proportionate in our interventions where we need to make those interventions, and that we engage much more proactively and support AEIs to mitigate risks where there are concerns that these might not be being met. Next slide, please. So underpinning our quality assurance framework is our quality assurance handbook, which is our how-to guide, if you like. It sets out the detail of our requirements, and for education institutions, it really clearly lays out the things that you need to do as part of approval, as a part of monitoring, in order to be able to meet our standards. So it really is a kind of guide talking you through all of the processes that ourselves and Mott MacDonald use in quality assurance of education. And both of these are available on our website. Next slide, please. So in terms of quality assurance of SCPHN programs, post-registration programs, the quality assurance takes place in line with our standards of proficiency, which is essentially what individuals undertaking these programs need to be proficient in and competent in when they complete their programs in order to gain the qualification. And then our education and training standards. which are broken down into different parts. So part 1, the standards for nursing and midwifery education. Part 2, the standards for student supervision and assessment. And part 3, the program standards for post-registration education programs. And then also, for those of you who will be including prescribing within your programs, the standards for prescribing programs as well. And AEIs need to think about all of these standards and how they interlink when they do submit their request, but as they're beginning to think about how they're going to develop their programs. Next slide, please. So in terms of kind of transition and approval of new programs, so there is a transition period, and probably I'll start with the third point there, which is that no students will be able to commence a program approved against the old 2004 standards after the 31st of August 2024. So AEIs need to make sure that they're allowing themselves enough time to undertake the QA processes required before that date if they do want to run these programs. So once AEIs have decided and made initial decisions about the routes, fields, qualification, whether to include prescribing or not to include prescribing, you submit a request through our system, which is called the QA link. And the new QA framework supports a gateway approach to approval. So once you put in that request, Mott MacDonald, Ian, or his colleague Pam will get in touch with you to talk you through the approval process in more detail. I mentioned the different parts of the standards, and the parts of the standards line up with the gateways. So Gateway 2 focuses on the standards for student support and supervision and assessment, so the SSA. Standards within Gateway 2, and Ian's going to come on to talk much more about the requirements for post-reg programs in a bit more detail later on. Gateway 3 focusing on the proficiency standards and the post-reg program standards, but also importantly their relationship with Part 1, so the standards framework, and Part 2. And then Gateway 4 is the approval event, which might be in person or take a hybrid approach. So again, just to highlight that the timelines for QA approval from that initial request in the QA link is about 6 months. So you need to factor that into your timelines and your plans going forward. Next slide, please. So this slide again just highlights our gateway approach to approval. So the initial request, so Part 1, standards framework for nursing midwifery education, mapping up with Gateway 1, the SSA, Gateway 2. And this just shows how you need to proceed through each of those gateways. A QA visitor will be assessing the evidence that AEI submit into each of those gateways and needs to be assured of that evidence in terms of meeting requirements before the process will proceed through the other gateways. So Gateway 3, and we'll talk about this in a bit more detail, is the program standards, and then Gateway 4 is the approval visit. So that's the approval event. That will result in a visitor's report, and then once the visitors produce that report, that comes to the NMC. The university, the AEI, will have a period of time to make any observations of that report, and then it's the NMC who makes the decision to approve that program. Next slide, please. So I mentioned Gateway 2 requirements, and as I said, Ian will talk about this specifically in a bit more detail, but these are the standards for student supervision and assessment, and these might be new to a lot of you in AEIs, but I suspect will be new to a lot of colleagues in the practice learning environment. It's a new language. It's moving away from the language of mentor to practice supervisor, practice and academic assessor. And really the relationship between those people and how that works to support individual students progress through their programs and meet their proficiencies. And it really highlights the key relationship between AEIs and their practice learning partners, and that the need to develop the model or approach collaboratively. And it's probably going to look very different to what is already currently in place. It also needs to consider how practice learning clinicians are going to be prepared for their role as practice assessor and practice supervisor, how you're going to ensure that they understand the requirements, and also that they have access to updates, CPD and support that they need, but with a particular focus on post-registration students and the requirements for those individuals. I think I'm handing over to Ian now. Next slide.
Yes, thanks, Paula. Yeah, could we go back? Because I think we've skipped forward a couple of slides, actually. We should be on slide 17 now. So thanks, Paula, handing over. So what I'm going to talk to colleagues is just to give a little bit more granular detail. So on slide 17, once it's gone back, there we are. Thank you very much. So in terms of the Gateway 2 considerations, so Gateway 2 is directly related to how the SSSA is implemented, as Paul has just explained. And there are three key sections to the SSSA within Gateway 2, as you can see there listed on the slide. So in the context of the post-registration standards, it's expected that AEIs will request for their approved Gateway 2 to be reopened in respect to R6.5 for SCPHN and for R6.7 for SPQ that we discussed last week on the webinar. Opening up of Gateway 2 and having that accessible is something that happens at the time that an AEI submits their program approval request to the QA link, and then it will be accessible for updates. So R6.5 in relation to SCPHN states that AEIs and practice learning partners must ensure that specialist community public health nursing students are assigned to practice and academic assessors who are NMC registered SCPHNs with appropriate equivalent experience for the student's field of practice. So you can see that that standard is very linked to the SCPHN programme, and that it is likely that all AEIs proposing a new SCPHN programme will need to update that standard to clearly indicate how the SSSA is met in relation to a SCPHN programme. It's those two requirements that we would expect to see updated and aligned to the new post-reg programmes. AEIs shouldn't be making wholesale updates to Gateway 2 as part of their SCPHN programme approval, only updates to those that relate to the new post-registration programme. Next slide, please. So I'm just going to talk a little bit about what the AEI or the education institution must do in relation to Gateway 2. So as an AEI, what you'll need to provide is updated narrative in the relevant evidence requests within the QA link. So you'll also need to upload any documentary evidence that directly relates to the implementation of SSSA within your new post-registration programme and attach that to the relevant evidence request. So to be clear, each requirement that's updated requires narrative to describe how you and your practice learning partners or your employer partners in the case of apprenticeship routes meets the requirement and then links through to the relevant evidence documentation. And what's really important is that the narrative must clearly signpost for the QA visitor to the evidence documentation in the link, including where the documentation where in the documentation the relevant text can be located. When each of the relevant evidence requests that have been updated are complete from your perspective as an AEI, then you submit the overall gateway to the QA link, and that evidence then becomes visible to the QA visitors. Next slide, please. So what will the QA registrant visitor then do? So the registrant visitor will access and review the Gateway 2 evidence requirements that have been submitted for consideration. They'll assess the evidence against each of the NMC standards and requirements to determine whether that demonstrates that the requirement is met, or indeed it might be that they feel that there's further assurance needed. If when they review the evidence that's been uploaded for those evidence requests that have been updated, they feel that it's insufficient to demonstrate full assurance against that standard and requirement, then they will have a discussion with us at Mott MacDonald, the professional team. We'll discuss and agree what resolution is needed, and then that will be communicated through to the AEI. And then the AEI will receive directive feedback as to what the omissions are and how to remedy that. Now, normally an AEI would be given 2 weeks up to 10 working days to resubmit Gateway 2. And then if content and everything is deemed to be assured from the visitor's perspective, Gateway 2 will be approved, or in the majority of cases, Gateway 2 will be reapproved, because obviously many AEIs will have had Gateway 2 approved for previous programs, and it's just the update, so it will be reapproved against the updates. And the process will then proceed on to Gateway 3. And I'm coming back to you, Paula, for the next slide, please.
Yeah, thanks, Ian. So the next slide refers to Gateway 3 as the program standards, and we've done a lot of work around these standards with a specific additional focus on equality, diversity and inclusion. So Gateway 3 focuses on the student journey and the means to achieve proficiency, as we've been discussing, and includes the new curricula, how that would look in order to meet the proficiencies, the management of the program of study, the delivery and the support. But with regards to the EDI focus, the specific requests that we will be asking at Gateway 3 of all approvals going forward is around student population and diversity data. So thinking about your local populations and how your student population matches the diversity of your local population. We're also asking more about attainment gaps and for all of your programs, and any action plans that may be in place to address any of the gaps identified. And most of you will know that we're asking about attainment gaps and action plans through ASR as well. So it is something that we're going to be asking to see more and more of in that space going forward. Particularly interested as well in people who use services and carers and how they're involved in the development of programs, how they're involved in recruitment of students onto programs and interviews, etc., and how they're prepared for their roles, including diversity aspects as well. I'll hand it back to you, Ian. Thank you.
Thanks, Paula. If we could have the next slide, please. So in relation to Gateway 3, just to follow on from the information that Paula's just given around some of the key considerations. So following successful completion of Gateway 1 and Gateway 2, the AEI and their practice learning or employer partners will proceed on to Gateway 3, which is the programme standards. As many of you are aware, and I'm sure was outlined earlier, that there are independent programme standards for all programmes, and all programmes also have independent standards of proficiency. So there are 5 standards underneath Gateway 3 that mirror across all of the different programme standards, and under each of those standards there's a number of requirements, and each one of those are individual evidence requests within Gateway 3 that the AEI will need to provide evidence against. Next slide, please. So just to talk a little bit about what the AEI or the education institution will do within Gateway 3. So as per Gateway 2, all AEIs proposing a new post-registration programme will need to add narrative and evidence documentation to Gateway 3. So this will obviously be for all of the evidence requests in Gateway 3, as this is a programme approval against new standards. So Gateway 3 will be unpopulated, and AEIs will need to upload narrative and evidence against each of the evidence requests that mirrors the requirements within the standards. And again, it's really important to clearly signpost the relevant document or the section in the evidence for the QA visitor that you are proposing demonstrates assurance against the particular requirement. So effective partnership working between the AEI and their key stakeholders is a really key principle underpinning the QA framework. And that includes the commitment to actively engage people such as patients, people who use services and carers, and the public in programme development and the proposed programme delivery. And this should be reflected in the programme documentation that's uploaded into Gateway 3, but also throughout the approval process. In addition, the programme needs to be designed to ensure that the NMC programme standards and the relevant standards of proficiency are explicit in the intended programme. So various mapping documents should be uploaded at Gateway 3 to demonstrate how the standards and proficiencies are met. And the programme must also demonstrate that it's compliant with the standards framework for nursing and midwifery education and the SSSA. So the requirements at Gateway 1 and Gateway 2, how are they implemented in the programme? There should be evidence in Gateway 3 to demonstrate compliance and that implementation of the overarching standards framework and SSSA standards. And it's really vital that contemporary knowledge and practice is addressed and is evident within the programme documentation submitted to Gateway 3. So that links in with what we've heard earlier from Elaine and Paula about this being a new programme against new standards. Documentation that's provided to QA visitors and the approval panel must be the same. So that documentation at programme level that AEI is uploading to Gateway 3 should be the same programme documentation that's provided to the internal university panel. And the NMC expects that all of that documentation is the same and it's provided to both the internal university panel but also the NMC visitors through the QA link, so that the information that's being analysed is consistent and it leads into a conjoint approval process, and that can be assured that it is a true conjoint process. The QA handbook that Paula mentioned earlier outlines the types of evidence and documentation that's expected at Gateway 3, and that includes things like the programme specification, module descriptors, CVs for the programme team, practice assessment documentation, and various mapping documents. There are certain expectations related to practice learning partners and employer partners, depending on whether a direct entry route, an apprenticeship route, or both types of route are being proposed within the programme. So for direct entry routes, there must be written confirmation by the AEI and associated practice learning partners that there are resources in place to support the programme intentions. And that should include a sample of signed protected learning time agreements for students undertaking the programme. And for apprenticeship routes, there must be signed statements of commitment by all employer partners who will be delivering the programme in collaboration with the AEI. And that should be demonstrating their commitment to deliver the programme according to NMC standards. The other thing I wanted to mention on this slide in relation to evidence at Gateway 3 is that AEIs and their practice learning partners or employer partners might wish to transfer current students onto the new programme to meet the new standards for post-registration programmes. If that is the case, then evidence must be provided to support the proposed transfer as part of the mapping process at Gateway 3. And students who would potentially transfer must also be able to engage with the QA visitors during the Gateway 4 approval visit. If I could have the next slide, please. So I mentioned earlier about the programme documentation at Gateway 3 must be able to demonstrate how it meets compliance with the standards framework and the SSSA, so the Gateway 1 and Gateway 2 requirements. So QA visitors will be looking when they're reviewing the Gateway 3 programme level evidence to ensure that the Gateway 2 and Gateway 1 and Gateway 2 requirements are met at programme level. So on the slide, there's an example of what we mean by applying Gateway 1 at programme level. So R 1.12 in the standards framework states that AEIs and practice learning partners must ensure programmes are designed, developed, delivered, evaluated and co-produced with service users and other stakeholders. And that's linked through into the Gateway 3 programme standards in the standards for post-reg programmes under R 2.1, where you'll need to provide evidence to confirm that your programme complies with the standards framework. So a QA visitor will need to see evidence in the Gateway 3 programme documentation that people who use services and other stakeholders, for example, students or practice learning partners, are therefore engaged in all of those various aspects of the programme. So evidence of how you've worked with the stakeholder groups to design the programme is required, as well as evidence of how stakeholders will be engaged in future programme delivery and evaluation. The co-production piece is particularly important with regard to curriculum design and relevant expertise. AEIs will need to provide evidence that colleagues with the relevant knowledge and expertise have been engaged in the co-production of the programme that's being proposed. And that has to be at root level. So this may be from an internal resource or it may be engagement of external support. For example, a SCPHN occupational health nurse route that's being proposed, the AEI will need to provide evidence that someone with an occupational health nurse qualification or someone with current expertise in occupational health nursing has worked with them to design that particular route within the programme. The QA visitors will be looking for assurance that all individual routes on a programme have been co-produced with individuals with the relevant qualification and/or expertise. Next slide, please. So once you've uploaded your evidence and you've submitted Gateway 3, the registrant visitor and the lay visitor will independently access the evidence requests, which must signpost them to where the evidence is located in the QA link. The QA visitors will have 4 weeks to independently analyse the narrative, programme documentation and any supporting evidence, and the evidence provided will be assessed against each standard and requirement to make sure that the evidence confirms how the NMC programme standards will be met within the programme. The visitors will then independently produce the initial draft programme approval report, the IDPAR, and that will identify areas where further assurance is required, including any requests for additional evidence documentation. And that IDPAR will also outline the areas for exploration at the Gateway 4 visit. The IDPAR is submitted to the AEI via the QA link PAR record, and that's submitted at the end of week 4 of that review period, and that will be 2 weeks before the Gateway 4 approval visit. And the AEI isn't able to proceed to Gateway 4 if the QA visitors are not satisfied from their analysis of the documentation in Gateway 3 that the AEI and their PLPs will meet the programme standards through the programme that's been proposed. If I could have the next slide, please. So to talk a little bit about compliance at Gateway 3 and then move on to readiness to proceed to Gateway 4, the AEI, you'll receive the IDPAR 2 weeks before the Gateway 4 visit. What you'll need to do as an AEI is you'll then need to develop a response to the issues that have been raised within the IDPAR and collate any additional evidence documentation that's been requested. And that must be completed and uploaded within 5 working days so that the response is available in the QA link 1 week or 5 working days before the Gateway 4 visit for the NMC QA visitors to review. The information that is included in the IDPAR and the response should also be made available to the chair of the approval panel, and that will help to inform the agenda of the approval panel visit because it will identify any issues that need further exploration. One of the things that's really important to be aware is that the visitors aren't able to review any documentation that is provided to them immediately before or tabled at the approval visit. So all documentation must be either uploaded initially at Gateway 3 or subsequently in the IDPAR response. Now to talk a little bit more about the proceeding to Gateway 4, AEIs will be able to proceed from Gateway 3 onto the Gateway 4 visit if the QA visitors are satisfied that there's sufficient information available to proceed on to meet with stakeholders and their representatives as part of the final triangulation of that documentary analysis of the programme standards. If I could have the next slide, please. There are occasions when sometimes AEIs aren't able to proceed from Gateway 3 onto Gateway 4. And normally that would be that the evidence in Gateway 3 suggests that the programme isn't ready to proceed to Gateway 4. If both of the visitors agree that there are serious concerns at Gateway 3, then they will discuss that with us at Mott MacDonald, the professional team, either myself or my colleague, Dr. Pam Page. QA visitors will detail their concerns to support what we term a do not proceed decision. And that will then be communicated through to the AEI, and there'll be an arrangement to have a conversation with the AEI to discuss that decision further and what the process would be from that point onwards. And that's really important. And one of the things that we've seen is that AEIs that have had a do not proceed decision have indicated that actually it's a preferable outcome, because the other outcome could be that they could get a recommend refuse outcome at the Gateway 4 if the programme isn't in a position to proceed. And therefore that has quite significant reputational impact. It does happen in a minority of cases. It's not something that happens very commonly, but I'm just stressing the point about the importance of getting your documentation in a state that clearly evidences that the standards are met in order to be able to proceed with the Gateway process. If I could have the next slide, please, which is the last slide from me. So just to talk a little bit more about the Gateway 4 approval visit. So we currently conduct approval visits as a physical face-to-face event, or remotely via the AEI system, which most commonly is MS Teams. The NMC have agreed parameters with us to decide whether a visit should be face-to-face or whether it should be remote. For example, if a programme includes an apprenticeship route or is particularly complex due to the number of routes that are being proposed within the programme, then that will be a face-to-face physical visit. But if a programme is proposed with a single SCPHN health visiting route, for example, then that would likely be conducted remotely because it would be a more simple visit because there's only one route being proposed. AEIs will be advised during the scheduling process whether the visit will be face-to-face or remote. And if it's remote, it's expected that the university panel and all stakeholder groups will also attend remotely. So it's a completely virtual event that will happen if it's determined to be a remote visit. The NMC expect an approval visit to be a fully conjoint process with the AEI. So that means that a full university approval panel must be present, including an external subject specialist. And the university panel and the NMC QA visitors must agree outcomes at the end of the Gateway 4 visit. A programme cannot be pre-approved by an AEI and then presented to the NMC panel. The approval must happen on the day of the conjoint approval visit. The QA handbook includes a list of expected members of the university approval panel, and that includes a student and service user representative as part of the internal panel. The agenda for the approval visit must be agreed and approved by the QA visitors well in advance of the visit. So AEIs are guided to start developing the agenda for the Gateway 4 visit as soon as they've submitted Gateway 3. The agenda should also include names and roles of the university approval panel members and all stakeholders who will be attending the event to meet the conjoint panel. And the QA handbook includes details of a suggested agenda and a list of all stakeholder groups that the NMC expect QA visitors to meet with. If the QA visitors aren't given the opportunity to meet with all stakeholder groups as determined and outlined in the QA handbook, then they won't be able to complete the visit and they won't be able to recommend the programme for approval subject to any conditions. In terms of stakeholder engagement, if a visit is scheduled as face-to-face, then the expectation is that all of those involved will physically attend the visit. So that's the university panel and all of the stakeholder groups. We do obviously acknowledge that there are often exceptional circumstances that might prevent certain stakeholders from attending physically. And then it could be agreed that those colleagues might be able to attend virtually, but that is something that would need pre-agreement with the QA visitors and with the Mott MacDonald professional team. But there is that capacity there should that become necessary. Paula, I'm not sure if there's anything else that you want to round off before we move on.
No, I don't think so. Hopefully that's really helpful. Kind of Ian's given quite a lot of the detail, but you've probably got lots of questions still as a result of some of that. So we're happy to take any questions through the chat while Elaine continues with the rest of the presentation. Thanks, Ian. Thanks, Elaine.
Thank you, Paula and Ian. That's lovely. So what I'm going to do now is just really, we're going to go on to some of the key messages that we're giving through, that have come out really through the consultation processes we've been having and through our discussions and with our QA team and Mott MacDonald about the documentation that is coming in. So first we've got another little poll to put up, which will come up on the screen shortly. Just on a score of 1 to 5 on that little black box that's on your screen. On 1 to 10 it is, I do apologise. Can you just indicate how confident you feel in your programme at the moment, with 1 being not so confident and 10 being that you feel really confident in going ahead? And again, we'll just give this, I don't know, 20 or 30 seconds for you all to put something in. You need to just click on the number and then press submit. And then it usually shows up quite well for us. Yes, it's starting to show up, doesn't it? Excellent. Just give you another second or two. So actually, I think, yeah, looking at the score, we've got a lot of people, well, a quarter of you are feeling quite confident in that. Nobody's feeling really, really confident, but that's probably normal. It's quite reassuring. I think quarter sitting in and nobody's feeling not confident at all. So that's really good to hear as well. So hopefully the likes of these webinars and the engagement events that we're doing will help improve that. We'll just close that now. Thank you. We'll move on. So the other thing, just a few things to highlight really that are coming up in all the questions that we're getting asked. Ian mentioned there about there's 5 parts. Part 3, so when you're going through your process, Okay, so you have then 5 parts, 1, 2, 3, 4, 5, and the first one being selection, admission and progression. The key is coming up that is a bit different in part 1 in your selection process is that there needs to be evidence of how you will support people that are underrepresented, access the programs. That might be people in different minority groups, or even males access the scheme. Because we know we do have a lot less males than females onto these programs. Equally, how will you support self-employed or self-funded students? So moving away from the NHS, how will you support people that aren't employed by the NHS to access a place on this programme? Obviously, considering that, you need to ensure that the practice placement would go through your same rigorous governance and procedures from your academic educational institution and meet the requirements of AAA for the practice. So that's still all in place. The other thing you need to consider is about RPEL, so recognised prior learning or recognised prior experiential learning, and how students can access or map that RPEL to gain entry onto your programme as well. If you are considering putting prescribing into the programme, you know it needs to meet the NMC prescribing guidelines and the RPS prescribing guidelines and the standards that it is stipulated there at 1.7 and 1.8, but also what is the access? So if you have a student, for example, who's done V100 or V150, how can they to access the V300 on your programme? We have got a few examples as we come along about RPEL as well. Okay, so the curricula, the first thing you need to decide between your practice partners and your education institution is what route you want to deliver. So do you want to deliver health visiting and school nursing and occupational health nursing? Is there a need for a public health nursing route as well? Be there. Okay, so that is a decision for you to make. You also need to think about the length of the programme. Whether you include V300 might influence that. The NMC state that you have a minimum of 45 programmed weeks. So they're weeks on programme, so exclusive of holidays. So 45 weeks where the full-time weeks where the student is gaining learning through practice or theory content. After that, it's up to you how you design the programme, and that would be pro rata for part-time. So if it was 45 full-time programmed weeks and you had exactly 0.5 equivalent, you'd expect it to be 90 programmed weeks for part-time. But again, that's entirely up to you how you design that programme. So, the practice learning opportunities, you need to have people in practice, supervisors and assessors, which I'll touch on shortly, with experience in the student's field of practice. But also you need, like Ian suggested, as mentioned as well, you need to have kind of a university that can support that field of practice for that route. So people that are, health visitors to apply context to health visiting, school nursing, and the same with occupational health nursing as well. And equally, if you are planning on doing a public health route, that you've got somebody that can support the context of learning, both in theory and in practice for the programme development and design and delivery. And supervision and assessment is a bit different now. You'll all be very familiar, I'm sure, with the SSSA standards and how they fit with supervision and assessment. And this is slightly different as well now. So we do expect that the SCPHN programme does fully embed the SSSA, which requires the supervisor to have gained a SCPHN qualification and completed a period of preceptorship. And it requires the assessor to have a SCPHN qualification in the same field of practice as the student, and so have experience of assessing post-registration students, and again also completed their period of preceptorship. So then requirements are there. There is a requirement as well for universities and practice partners to demonstrate how they will prepare and provide ongoing support for practice supervisors and assessors to support students on the programme. The other thing to be mindful of is this is a master's level programme now. So it is up to your use, how when you design your programme, whether that is at postgraduate diploma or at full master's level. entirely. However, it must be at that level. So that's something to consider as well in your selection and admission process, that you need to evidence that students who are coming on the programme have got the ability to study at this academic level. Okay, the next slide, please. I think I've probably touched on some of the key points in this next slide, and certainly I know Ian and Paul have touched on that as well. Again, some of the extra support and information. Again, it's really important that we've got co-production of programmes. So we know that universities and practice partners working really well together, but involving the students, so SCPHN students and people that use SCPHN services. It's really important to have their view and their input in the development and design and delivery of your programmes. We've touched on self-funded and preparation. The other thing that's really clear is that you'll know now that we don't stipulate at the NMC that it's a 50-50 practice theory split. So this new programme gives you a lot of opportunity to be creative and work out what practice and theory split works best for your students. Okay, there are a few other little bits of the questions that are coming up that I'll just mention, is that you'll see in 2.8, the standards that it asks that we ensure that simulation and technology enhanced learning is applied proportionately throughout the programme. And be different, it's not the same as it is in pre-registration programmes, which we quite often get asked, is there a certain number of hours? It's about how you can be creative in using that and to support the teaching to meet the proficiencies required for SCPHN practice, both in theory and in practice. And again, how that is balanced throughout the programme. Again, we don't stipulate that there is that period of consolidated practice anymore, but what the standards say is that the programme must culminate in a period of practice learning, and how that practice learning looks or how long it is entirely up to you and your programme development team to decide. There's no longer the stipulation of the 10 or 15, it was, wasn't it, alternative practice days. So again, how you design practice learning is up to you to be really creative and innovative within your programme. Okay, some other things just to consider is, and I know there's been a few questions about that in the chat box, obviously in England, there may be a need that so design a higher apprenticeship route, and how will that look against a standalone route that isn't apprenticeship, a direct access route rather than apprenticeship route. You will need the apprenticeship standards, obviously, to be published prior to being able to design that programme. There is opportunity for shared assessment documentation. I know all 4 countries in the UK have got steering groups and working groups about making regional and national practice assessment documentation. And also, yeah, thinking about, well, actually, the last one is more about SPQ, so we'll leave that. And when we talk about designing and sharing shared work for practice assessment documents, it now brings me nicely onto Ellery, is one of our colleagues from Wales, who has been very instrumental in doing some work. So I think it's really nice to share that information. Hiya, Ellery. That's just for the next slide, please, Govinda.
Good afternoon, and thank you very much. I'm just waiting for the next slide to upload. Thank you. So there's a practice assessment development approach in Wales, and currently Health Education and Improvement Wales have actually seconded 2 programme managers, myself, Ellery Mills, to lead on the SCPHN programme, and Jodie Hill to lead on the SPQ programme, to undertake this programme over a period of 12 months. And the aim of this particular project is to co-produce and to develop an All Wales practice assessment document, and that's for implementation, as you know, of the current NMC standards by September the 1st, 2024. And one of the stance that Wales have taken in particular is that they do want a PAD to be as similar and as aligned as possible across the SCPHN and the SPQ pathway. And I understand, obviously, there are some various groups in England in particular that are developing a SCPHN pad that are maybe particularly for SCPHN, but certainly in Wales, we're looking to develop as much of that within the SBQ framework as well, so that there's more alignment between those two pads for practice assessors and practice supervisors, who will obviously be involved in the completion of these particular documentation. By doing that, we will have a Once for Wales approach. It worked very, very well with the undergrad programme. And again, we're looking to repeat that for the post-registration programmes as well. Currently, we are in development. We are in the process of collaborating with various stakeholders in relation to this. We are into that process already, and we had our last meeting on Thursday last week, with the next one coming up towards the beginning of next month. And what our remit is to develop a Word version of an All Wales pad in draft by August 2023, with a view of having a final version approved internally within HEIW by November 2023. Again, that will then be up to every university in Wales to actually apply that to their own particular electronic pad platform, whichever they actually have a contract with. So over to you, Elaine. Thank you very much.
Thank you, Ellery. That's lovely. It's good to share some, you've got some really good examples going on there. And equally, I do know the other countries have got some really good work going on, and Ellery was really kind enough to come and share that today, so thank you. So just another little quiz, just to see who are you working with in your programme team. So again, just tick it on the box that's on the screen and press submit if you can. Just a moment, just to see how people are managing really to engage different people in the programme team. So I can see a big majority there is managing to get some members of the public in, and so are engaging with everybody. And I do know that that can sometimes be a challenge. Okay, thank you. That's lovely. We'll end that just so we don't go on. So really what we're going to do now is just give you a few examples really to help you. By no means are these examples meaning this is exactly what you've got to do in your programme. It's just things to try and give you a bit of a scenario how it might help you. So when we talk about the self-employed or self-funded route, for example, a lot of people have asked questions on that and how that would fit within the SCPHN programme. So one of the things we want you to think about is that we talked about, moving away from the NHS. So it's not just about the student that may want to self-fund out of their own pocket, their own financial arrangements, but also you may have people working in private agencies. We know, for example, in one area of the country, there's a private agency that delivers public health into schools now, and so they go in just to deliver the public health messages. They don't take on individual work or child protection work or anything like that, but it's mainly about delivering public health. But their employer wants to support their nurses to become SCPHN school nurses. So actually what they can do is apply, that student could apply under the self-funded and self-employed route to their approved educational institution. I keep saying that word wrong. Okay, so that would cover the costs associated with the programme, and the university would have to make sure and do their governance and their quality assessment audit to make sure that team, as to speak, could meet the SSSA client requirements, and it would be a good provider for SCPHN education. So everything would be in place, and for the student it would look exactly the same. The difference would be how the university or the placement provider got their money, not what the student journey was and the student experience. So it's just one example, and I know there is lots of, when you're talking about the public health route, in particular the public health nursing route, there may well be lots more providers out there as well that have got a similar interest. Okay, next slide. So when we talk about one of the examples we get asked, or one of the questions we get asked a lot, is about how you can put recognition of prior learning into your programmes. Okay, so we got, for example, it may well be one of the questions we get asked is that now these new standards incorporate RPEL about the NMC circular about working in an alternative field of practice will be removed. This will no longer be in place as of September 24. So what you could have within your programme is you could have some RPEL that recognises the experiential learning. So if you had a health visitor that wanted to gain experience working as a school nurse or the other way around, actually what learning would they have to do on your programme to support them to gain that experience to meet the standards for school nursing so that they would be competent to work as a school nurse, even though they have the qualification as a health visitor. They would still remain as they currently do, and that would be exactly the same, registered with the NMC and in the initial primary SCPHN qualification, but RPEL would support them gain that experience, whether that's through a practice assessment document, some theory learning, as well as practice experience. Again, like I say, these are just examples. It's up to you how you develop these. Okay, the next one. So other things we get asked a lot on is about simulation and technology enhanced learning, and you'll know that standard 2.8 asks you to consider going to apply that proportionately throughout the programme. So we have no set number of hours that need to be or anything. It's about thinking about this as a learning theory, really. Okay, so you could, this is a really good way of using simulation or learning, how you can support bringing in our service users and our members of the public to support programme design and development. Okay, using members of the public to help learning is a really good teaching tool, and it's really does evidence that simulation as well. So you could easily ask members of the public to come in, and the student could be asked to take a particular assessment, complete a health assessment and get a real feel of what it's like, and then communication skills, then advanced communication skills in particular that you need in SCPHN practice. But again, it could demonstrate some simulation. In health visiting, I think breastfeeding is quite common, that students get a lot of simulated practice in that. And simulation can fit both within theory as well as in practice, and particularly for some of the proficiencies that might be hard for students to see out there in practice. Some areas we know have got some good examples of where they use safeguarding scenarios in strategy meetings or child protection and multi-agency meetings, but where the students expected to act in the role as they would as a health visitor. So it's a real simulated learning environment, and between practice and the university, they provide that setting, and the students expected to act in that way and provide information in the way that what they have available. So it gives students a bit of context to what could be going on when they're out there in practice. Okay, I think that is we've got one more poll just to see if come the end of this session today, before we go on to the question and answers, if people feel any more confident this is. This is again 1 to 10, 1 being not so confident and 10 being that you feel a bit more confident than you did prior to having implementation support that is available. I'll let you answer that, and then we'll close that, and then we'll go over. I'll ask Aditi to come to me with any questions that are coming from the chat box. I can see there's been a few coming up. Again, if you have any questions, please do put them in the chat box, and then we will try and answer them. We've got a bit longer there now, and so thank you for your attendance. I know some people do have to rush off. I know we tried to deliver it at lunchtime, so it fit more people's needs. Okay. Okay, thank you. Aditi, I think we can stop sharing probably now.
Thanks, Elaine. So we do have a few questions, and I'm going to start with Neil's question on individual service users for occupational health nursing being quite hard to engage because obviously the population is further away, or the employer may not be able to allow time off work, etc. So his question is it possible to use the users of occupational health services within the AEI as part of the involvement of public users, etc., for the development and the delivery of the programs.
I don't think, sorry, I'm going to ask Paula to come on there. I don't think I'm quite clear what the question is there.
Yeah, that's fine. I was actually just typing a response in the chat box. So Neil, good question. I think it's about providing evidence of how people who use services are engaged in the program that's being approved. So happy to, and QA visitors will be happy to look at innovative approaches, but it will be related to the program that's being approved. So if that means people who use services within the university, you'd have to provide evidence of how that relates to the program that's being approved. Hopefully that helps.
Thank you both. A question on SSSA now, and it is actually a specific scenario that Kelly's asked, and it's about a practice partner who's proposing that one SCPHN school nurse is being proposed to be the practice assessor for all of their students across health visiting and school nursing. And they have said that they do meet the SSSA requirements, so the employer agrees that they meet the required experience and knowledge for the corresponding programs. Is that permissible? So is it possible to have one practice assessor for health visiting, all of the health visiting and school nursing students? That is the question.
Yeah, so what the standards say, and it's 4.6 in part 3, if you want to look at that, Kelly, certainly that might help. It says that the student should be assigned to a practice assessor who is an experienced registered SCPHN for the programme the student is undertaking. So if they're undertaking a health visitor programme, the practice assessor should be a health visitor. If it's undertaking a school nursing programme, that would be a school nurse, because they've got to be able to support the student to meet them specific standards for practice. So that is there, that's quite clear there, I think, in the standards there.
I will add to that though, Elaine, because I think you're right that ideally we would want them to be from the same field of practice, but there is an element of being able to demonstrate their suitability in terms of knowledge and experience, because we, particularly now, we can see that there's a lot of movement of the workforce across from health visiting to school nursing, and lots of people may be qualified. It's kind of hard to comment on an individual scenario, but we're assuming that as long as they're suitably prepared, there's a potential. But as Elaine said, it's preferable if they are from the same field of practice, but through prior learning and experience, and if they can demonstrate that they are the suitable individual for supporting students as a practice assessor, then that may be possible. But it's really hard to comment on individual scenarios. That's why, broad answer. All right.
Thank you.
There is another question. Just trying to. Yeah, so this one's about interruption of studies. And so it's a scenario where students could be on the old standards when they started off, which is often the case, particularly in the transitional phase, and they have had to have an interruption to their studies. Do they need to be transferred onto the new program, or do they have to redo certain bits because of the transition?
I think that maybe depends on how long they're going to stay. So what they say is that students can complete the program they started. If the program is, it's a student that started this year, for example, in September 23, they have an interruption, they should be able to complete the program they started. Where that might get complicated is that they won't have any new programs on the 2004 standards running from next September. So Paula might come in here to add something different, but I would imagine that would be on an individual base, how they had to map that student's learning to the new program.
Yeah, absolutely. And if I think Ian mentioned in his presentation that if you want to transition students onto the new program, you'll have to provide evidence of that. But Elaine's right, that students can complete a program that they started, but that's given that the program that they started is still running. So you do have to think about those transition plans for those individual students. Aditi, there was another question, if I may.
Yes,
So,
sure, go
so
on.
this was a question around demand from a local trust to commence an annotation from a school nurse to a health visitor. I'm assuming that that the individual already has an annotation as a school nurse, in which case this would be seen as a CPD. So, and Elaine, you might want to come in on this because that wouldn't be a completely new program. They would still have their annotation as a school nurse, but this would be seen as additional scope of practice so that the employer was happy that they were prepared for moving into a health visitor role. So we wouldn't approve those programs. We would see that as CPD on the additional for the individual. So hopefully that helps.
Yeah, because currently what's happened is people have used that NMC circular, haven't they? And it hasn't been a program that goes through NMC approval or university approval. It's very much been about that extended field of learning. But for this new program, I mean, that would very much come into, that's like that scenario we discussed. It would come into your RPEL, but it wouldn't be a whole new program or a whole new module. It would be how someone could use RPEL to gain that experience in a different field. But it is very employer led with a framework supported by the academic institution.
All right, thank you both. What I have done is I have put in the link from our SCPHN registration page about the additional field of practice point. This used to be in a circular, but we've withdrawn that, and whatever information was captured in that is now sitting on the registration side of our page. So you might want to have a look at that. There is another question. It's very simply worded, but it could be quite a long answer. And it is, why have we chosen V300?
You might be best to answer that, Aditi.
Yes, I might know the answer to that one. Quite simply, I think we had a huge amount of debate on this particular. So we started off with whether we want prescribing essentially to be a part of these programs or not. So that was the first and basic question. There was a lot of very passionate and very differing views on that one, particularly because of the potential implications for the length of program, etc. So we were very minded of all of those issues. At the same time, having to balance future-proofing the professions for what the public already expects. Because interestingly, from our engagement, we picked up the point that lots of members of the public were expecting that this already happens by default. So they almost assume that their health visitor or their GP nurse can prescribe. So there was definitely a public expectation that people in these specialist post-reg roles with these qualifications would be able to prescribe. But we have to balance all of the different things. And therefore, this was one of the key questions. We left it as optional. So it is entirely down to AEIs to work with their practice placement partners to determine what are the local workforce and service requirements and determine on that basis whether they want to embed prescribing. But there was an overwhelming consensus that the V300 qualification was a far more useful qualification in practice rather than the community prescribing one, because a lot of the medicines that are as part of the community prescribing formulary are in fact now available over the counter. So really, in terms of added value, it was felt that V300 was the qualification or that would be the most suitable one. So that's why we chose V300. And this was part of extensive consultation. Even pre-consultation, we really tried to get lots of discussion from different groups on this, educators, professionals themselves, and members of the public. And this is the position that we arrived at. Just looking to see if there are, hopefully that provides clarity. And we have got our what we normally also do, just for interest, is we publish our consultation response documents on our website. So all of the consultations that the NMC has run, you can have a look at how we tackled each of the different areas, what was the response rate like, and how did we arrive at that particular position. So all that is on our website.
Thank you.
Yeah, there is a follow-on question, and that's about, do staff need to have completed, those who have completed the V300, do they need to complete those who have completed V100, do they need to complete the V300 now? I'm assuming we are saying that the staff were going to support students. That is what they're trying to ask.
I think that's going to be employer driven, isn't it? That because depending on the need of that practitioner, if the employer wants them to have V300, then a lot of universities have that as a standalone module, and there may be RPEL in place that they can RPEL V100 into V300, but that would come from the employer and from the university. I don't think we're not saying there's a need for that. We're just saying if it's in the skipping programme from September 24, then it needs to be V300.
Yeah, and just to add to that, you did touch upon that, Elaine, in your presentation, that there might be individuals who have separately completed V300 and they wish to do a SCPHN program, and that does already include V300. But because they've gained that qualification, they can always appel the prescribing elements and just do the SCPHN one. So there is obviously that possibility as well. Okay. There is a question on return to practice, Paula and Elaine, if you want to take that.
I think Ian's answered it, hasn't he?
Okay, excellent.
So it's just about return to practice being for SCPHN being at level 6, and will it need to be reapproved? And it will, because it'll have to meet the new standards anyway.
Yes,
and it'll have to be level. It'll have to be master's level, depending on where it is, what level it is. I have to keep remembering that not all are level 7. Because they're Scotland, it's level 11, isn't it, for masters? So.
Just scanning through to see if there are any other questions that we haven't picked up. I just want to remind everyone that if you do think of any questions following today's event, then you can always email us. I will put our email in the chat box. If it's a QA related question, you can approach Mott MacDonald or our QA inbox, depending on the nature of your question. But yeah, please feel free to get in touch with us. There is lots of support available.
Yeah, that's lovely. Thank you. That's just, I think something came up there actually briefly early on saying about what support was available. So I think just to let you know again, I know I've been out or someone in the team has been in touch with quite a lot of yous out there, but we're here to support practice and to support AEIs to implement these new standards in all your areas. So we're happy to attend face-to-face events. It doesn't matter where you are in any of the 4 countries, or online events, but whatever is best. Obviously, as you're organising them, it's really good if you get in touch and we can see what dates and times suit us all best. But we're certainly happy to be involved, and we are also putting on a few drop-in sessions, one in July, one in August, and one in September, which will literally just be where myself and another member of the team are available for an hour online for you to drop in. It won't be a taught, like a delivered session like today. It will be an open forum for you to be able to ask questions. So then dates will be published, I think, soon. Okay, so watch out for them. But again, like Aditi had said, any questions you can contact us through the Education Standards inbox, and we'll get the answers to you as soon as possible. So thank you for attending. I hope that's been useful.
There is one question on the public health nurse role, the PHN qualification, and I think there was a previous question as well in terms of how they would be supported, etc. So do you want to clarify on that, Elaine?
Yes, I've seen that. I think so. The public health nurse role, and I've seen it saying could help us to teach on it. It's not about the teaching, who teaches on it. It's about that you've got somebody in practice and in university that helps the design and development of the programme and helps the student apply context to their learning. So can act as the academic assessor, for example. So depending on where that public health nurse was working, you would want somebody in your programme team, and you would need a supervisor and assessor in practice to support that context of learning.
Right, thank you very much. I can see lots of thank yous. I think people are moving on to their next meeting, I think. But thank you very much for your time, for attending the session today. As I said, please get in touch if you have any inquiries. We do want to have a few drop-in sessions, which will be purely Q&A type sessions where you can just come and ask a question, stay as long as you want to, interact with colleagues, etc. And yeah, we'll release the dates for those fairly quickly, but we'll also be sharing the slides from today. And I think the slides from our previous event from last week have also been shared. There's another event specifically on SSSA, and that's for July. The dates for those should be on our website. I think the registration link is live as well. So do come along and spread the word. And thank you again for your time.